Welcome. Our presentation will be delivered by our team of dedicated professionals that have worked together to ensure the successful inclusion of Bradley into the school community. Bradley attends a local primary school. He is in Year 2 and he was diagnosed with a mild intellectual disability prior to starting school. Our presentation will discuss what an intellectual disability is, what this means for Bradley, the strategies that have assisted Bradley's inclusion both in the classroom and in the social and emotional domain of development, as well as the collaborative process that has taken place to ensure Bradley's school years are the best they can be. A person with an intellectual disability has significant problems with problem solving, thinking and reasoning. People with intellectual disabilities are able to learn new skills and knowledge, however, they learn at a slower rate. Each child with an intellectual disability will present differently as there are varying degrees within the intellectual disability diagnosis. It is thought that 1% of the population has an intellectual disability, and of that 1%, 85% have a mild intellectual disability. What does this mean for the children that are being diagnosed with an intellectual disability? It means that with effective support, most children diagnosed with an intellectual disability will grow up to be independent adults. There are varying signs of an intellectual disability in children. For some children, signs will appear in infancy, while other children may not exhibit signs until school age. This is due to the varying levels of severity for intellectual disability. The most common signs of intellectual disability are achieving developmental milestones late, such as rolling, sitting, crawling or walking, talking late or having difficulty talking, being slow to master self-help skills such as toilet training, dressing or feeding themselves, trouble remembering things, difficulty understanding actions with consequences, difficulty regulating their behaviour, for example having explosive tantrums, struggles with logical thinking and problem solving. Often children with a severe to profound intellectual disability exhibit other health problems such as seizures, mood disorder, motor skill impairment, vision or hearing problems. An intellectual disability results from something interfering with normal brain development. For 2/3 of the children diagnosed with an intellectual disability, the cause is unknown. However, there are some common causes, such as genetic conditions like Fragile X or Down syndrome. Problems during pregnancy can interfere with fetal brain development. For example, alcohol or drug use, infections such as preeclampsia or malnutrition. Problems during childbirth may arise if the baby was deprived of oxygen during the birthing process. Illness and injury. Possible injuries that can affect the baby include the mother sustaining severe head injuries or near drowning during the pregnancy process, or if the mother contracts infections such as measles, whooping cough or meningitis, that too can affect the baby's brain development. As educators, it is not our role to diagnose an intellectual disability. However, we do need to be aware of the diagnosis process in case we need to refer children for specialist assistance. Most assessments for intellectual disability are completed by a registered psychologist. Quite often, families are referred to the psychologist either from a general practitioner or a paediatrician. There are two components that are assessed when diagnosing an intellectual disability. The first being of below average intelligence or mental ability. The second being a lack of skills required for everyday living. The first part of the assessment is intellectual functioning, otherwise known as the intelligent quotient or IQ. This refers to a person's ability to solve problems, reason, make decisions and learn. If a person is diagnosed with an IQ score of below 70 to 75, they will be diagnosed as having an intellectual disability. The second part of the assessment is adaptive behaviours. These are the skills required for everyday life. They include the ability to interact with others, communicate effectively, and take care of yourself. Adaptive behaviours are assessed by a specialist observing a child's skills and comparing them to children of a similar age. Skills assessed are a child's ability to carry out self-help skills such as feeding or dressing oneself, how they communicate with and understand people, how they interact with family, friends and peers of a similar age in a social situation. These two assessments combined will indicate whether or not a child has an intellectual disability and the severity of the diagnosis.
There are multiple characteristics to an intellectual disability that are diagnosed based on the intellectual function and behaviours as mentioned above. Bradley was diagnosed with a mild intellectual disability at the age of 4, therefore giving him an IQ between 55 and 70%. The evaluative IQ test must be based on the individual's level of functioning, such as expressive language difficulties, physical disabilities, and hearing or visual problems, whereas the level of adaptive functioning is evaluated by observing the individual's performance of personal and social competence in daily activities and interviews with parents or care providers. The characteristics of Bradley's intellectual function that influence his inclusion in the classroom include low academia, cognitive development, language skills, and attention difficulties. Bradley has difficulty learning to read and write, which will impact his progress in all curriculum areas. Bradley's intellectual function influences knowledge and understandings of reading and writing, including letter-sound relationships, phonemic awareness, spelling difficulty, and decoding strategies. He struggles with basic mathematical concepts without concrete materials and is unable to process more complex mathematics for his year level. Low academia skills will impact his overall learning and inclusion within learning tasks, leading him to fall behind his peers and develop low self-esteem. With the lower intellectual function, Bradley has multiple cognitive factors that influence his inclusion in the classroom. Bradley processes instruction and information at a slower rate than his peers. He has difficulty applying the conceptual knowledge he does understand to different learning contexts, and he is unable to think abstractly and understand logical concepts without concrete materials. These factors are addressed in the IEP to develop specific instructional strategies and resources for Bradley's inclusion in the classroom. Bradley's adaptive behaviour is evident by analysing his receptive and expressive skills that are undeveloped for his age. He has difficulty processing new information and following verbal instruction. Bradley's language skills will influence his self-esteem and impact how he collaborates with his peers and ability to communicate new knowledge and understandings. Bradley's intellectual function is reflected through his ability to sustain attention in independent and group learning tasks. He finds it difficult to organise new information independently to complete learning experiences. His ability to stay on task with learning experiences will cause him to become distracted by external factors, such as his peers, or easily frustrated with himself in challenging tasks. Mild intellectual functioning will delay overall learning with language, developing social skills, and competency developing independence of daily tasks. Learning will require repetition when learning new skills with the support of diverse strategies for inclusiveness within the class. These elements of academic achievement, cognitive development, language skills, and attention difficulties will influence the IEP goals and instructional approaches implemented by the educator to include Bradley in a regular classroom setting.
Teaching practices that focus on making learning processes visible. Explicit instruction is a systematic method of teaching with emphasis on the universal design for learning links in very well with explicit. If we were to apply explicit instruction and the universal design for learning, now we will view a video example which puts these instructional approaches.
Today we are going to be doing an addition sum. Now we started this yesterday, so we're going to re-look at yesterday's questions and then we're going to do some more sums today. So when we are adding, we are combining our two numbers. So the question we have today is 2 plus 3 equals what? So I'm going to do it first, then we'll do it together, and then you will do it by yourself. So 2 plus 3, I'm going to put 2 down on my board, and then I'm going to add 3 more. 1, 2, 3. So then I'm going to add them together. I've got 1, 2, 3, 4, 5. So I know that 2 plus 3 equals 5. Now I've got the choice of writing out on the whiteboard or the iPad. I'm going to choose the whiteboard. So I'm going to write 2 plus 3 equals 5. Now let's do it together. We can just put ours underneath. So we're going to do 2. So I've got 1 and you've got 2. Then we need 3. 1. Can you say it out loud? 2,
3.
Beautiful. Now let's add them together. Can you point with me?
1,
2, 3, 4, 5. So we know that 2 plus 3 is
5.
beautiful. What are we going to use to write our answer out? The iPad or the whiteboard? The iPad, beautiful. So can you write the sum out for me? Awesome, so you wrote 2 plus 3 equals 5. Well done. Now it is your turn to do the sum by yourself.
Assistive technology is an important tool and strategy for these are just a few examples of how the educator incorporates. Therefore, we can see that the underlying goal of incorporating all
Every child that receives special education services must have a written IEP, Individual Education Plan, and how that IEP is created depends on the policy and procedures the school has in place on dealing with students with special needs. The school that Bradley attends prides itself on fostering a culture of inclusion where community members, students, teachers, other school staff, parents, and members of the broader school community come together to collaborate positive and supportive values. This school has a specific learning support team which helps the teacher and other stakeholders discuss and share information through meetings. This school is continually sending staff for professional development to constantly improve their support to the student and all stakeholders. Foreman and Arthur Kelly says that the purpose of the learning support team is design an education program that meets specific students' individual needs. Who are the stakeholders on the IEP process and evaluations? Within the learning support team at Bradley School, there are 2 specialised teachers, both who specialise in special needs education, and 2 education assistants who have been trained in PM benchmarks to conduct running record assessments and small group activities with students from Year 1 to 6, including Bradley. 1 teacher is assigned to Bradley, working with him in a small group 4 times a week to develop his phonics and reports to the teacher on a weekly basis. Both teachers are there to support each other in their roles and report to leadership twice per term on the progress of the students. There is a team that is then made up to implement and assess current IEPs for Bradley. Parents are part of the IEP team and are important due to knowing the child better than anyone else. The classroom teacher, learning support teacher, and the psychologist make up the rest of the IEP team. Running alongside the learning support team is the school psychologist who sees Bradley on a fortnightly basis. He was part of implementing Bradley's IEP for this year and has reported on his conceptual, social, and practical domains. When constructing an IEP, sources of information are required and come from many areas. The child will have several stakeholders who can assess the child's strengths and needs, including their parents, who provide a perspective on their child that is different from that of the professionals involved. The classroom teacher present and past are a central source of information about the child's strengths and needs and strategies used that were successful. Schools' records are a good source of information that demonstrates the child's performance. There is a checklist that many schools use to make sure that the required information has been collected for the planning process. Discussion on key factors with stakeholders are important because it can help all who are involved to get to know the student better and understand what goals are to be focused on. Through these meetings, stakeholders can share ideas and concerns for the student, providing each other with multiple perspectives. Open communication among the stakeholders allow everyone to be exposed to the latest strategies and tools and to be able to support each other in their roles. Stakeholders meet to solve any problems that may arise during the terms. Supporting the parent is essential by listening and offering strategies and resources that can be used at home. Each stakeholder has a clear understanding of their own responsibilities and meet during the year to assess the student's goals. The best way to support the student in your class with special needs is to have a regular communication with their parents. Any misunderstandings can be avoided by being in regular contact with the parents and being open to hearing their concerns. When communicating on a regular basis, when you do have concerns about any problem behaviours, the parents won't feel shocked when they are informed of major behavioural issues. Find out from the parent what their preference is on being contacted. You may ask them on the parent information night or have a quick chat to them in the classroom. Some parents like to be emailed and they can respond quickly to these emails. Some parents may offer to be called on the telephone where it becomes more personal. Many parents are happy with a communication book going home with the student where parents and teachers can record any successes or setbacks during the day. Some parents may feel embarrassed that their child is needing additional support for their disability. Parenting can become quite competitive and special consideration is to be taken when dealing with the parents. When communicating with parents, express the achievements as much as the challenges with their child. Always express to them that you see the child and not their disability. The aim is to get the parent on side working together with you for the good of the child. Communicate all information to the parents that have come from specialty teachers, school psychologists, and any concerns that have come up with other teachers. Any meetings that are needing the parents' input, make sure you invite them. If they are unable to attend, suggest a telephone conference or a live video chat. As a teacher, the parent partnership is essential to your child's success. Without it, the child will grow, but not as much as when they have a parental support along the way. It is important that the teacher and the parent communicate on a regular basis to assist both parties. For example, if the child did not get enough sleep last night before or is having a reaction to the latest medication given by the doctor, no matter how small the communication, it still matters with the performance to the child.